headset and make sure your phone is unmuted when pressing the 1 then 0 command. I would now like to turn the conference call over to your host, Supervisor Catherine Barger. Please go ahead.
Thank you. Good afternoon. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Thank you for joining us a little bit earlier today. We are accommodating the upcoming press announcement of the U.S. naval ship, the Mercy. The USS Mercy will be a critical resource for the Los Angeles County community as we prepare for a surge in our hospitals, while still providing vital medical care to individuals not suffering from COVID-19. Dr. Ferrer is here to provide her daily update regarding the outreach of COVID-19 in Los Angeles County. She is also going to discuss the new order issued by the Los Angeles County Health Officer limiting the use of trails and beaches. I know that many of our people are spending more time outdoors to get exercise or enjoy leisure time, either alone or with loved ones. We want you to keep enjoying the outdoor space, but please remember to use common sense, avoid overcrowding, and always practice social distancing by keeping at least 6 feet away between you and those around you. Regional parks like the Arboretum and Botanic Gardens and the South Coast Botanic Gardens, as well as your local county parks, will currently remain open as outdoor spaces. However, group gatherings of any size are not allowed at this time. The more we are able to maintain our social distancing to slow the spread of COVID-19, the better we will be able to protect the health of our local communities. And now I would like to invite Dr. Barbara Ferrer, Director of our County Public Health Department, up. Thank you.
Good afternoon, everyone, and thank you so much again to the media for covering all of the information we're providing with a lot of both intelligence and accuracy. And I also want to thank all of our residents. This is a really confusing and for many people devastating time. Certainly, we all share having a lot of anxiety, but I really want to applaud everyone for trying to do your best and also for taking care of each other. We have a few weeks to go, and it's going to be more important than ever that we recognize how important we are to each other, even if we're not physically together. I also want to express my gratitude and deep appreciation to Supervisor Barger and all of the Board of Supervisors for their smart and compassionate leadership. I'm really proud to be part of this county team. And I thank all of the leaders across the entire county of LA, both county department partners, many of whom have shared the work that they're doing with all of our viewers and listeners and readers. But I also want to thank all of our county partners in the not-for-profit world and our business partners, our sports team partners. I really couldn't be prouder to be an Angelino at this point in time. And it's because of all of you. I want to update you on our current status. We're sad to report an additional 5 deaths today. All of the people who I'm reporting about today who passed were over the age of 60. There were 4 men and 1 woman. Yesterday I reported on an additional 9 deaths. And of those, 8 of those people also were over the age of 60. There was 1 person, unfortunately, who passed and was younger, a person in their 40s. They did have underlying health conditions. These numbers that I report every day represent the lives of real people, and they're people that are mourned by their families and their friends. And to those of you who are experiencing these terrible losses, we're here with you, and we're sending our prayers. And we're really so very sorry for your loss. Today we're also reporting 257 new cases. Over the last 48 hours, there have been 678 new cases, and the total number of cases in LA County now stands at 1,465. These cases include 54 cases reported by our partners in the city of Long Beach and 9 cases reported by the city of Pasadena. In less than a week, really I think only 6 days, we have gone from 409 cases to 1,465 cases. We've more than tripled the number of people here in LA County who are positive for COVID-19. This increase in part reflects a lot of improved access to testing, and we're catching up on being able to test people who have serious illness. But we also have to assume that these numbers represent the very real fact that we have a lot more people infected in the county who are capable of infecting others. The majority of the people who are infected are between the ages of, and tested positive are between the ages of 18 and 65. While you'll see with some numbers I'm going to report later, the majority of the people that are very ill and even those who have passed are over the age of 60. But the important fact here is for those of you who are infected, you are the risk for everyone else in our county. And if a lot of people who are relatively young are infected, then those very young people can in fact infect those people who are older and more vulnerable for serious illness and even death. So I ask you to do your part. 317 cases have at some point been hospitalized, and that's about 22% of all positive cases. At this point in LA County, unfortunately, 1.8%, slightly under 2% of people who have tested positive have died. And that's higher than the mortality rate both in New York City and in the United States. Again, New York City reported today, I think, over 25,000 cases and 366 deaths, which puts their mortality rate at about 1.4%. They have a lot more testing capacity, and therefore they've been able to identify many more people who are positive with COVID-19. Of the people that are currently hospitalized, which is about 70% of them are in the intensive care unit. And that includes the majority of those people who are in the intensive care unit, as I noted earlier, are older than 60. As always, confirmed cases are being isolated and their close contacts are quarantined. I also want to update information on the investigations at the 14 institutional settings where we have at least one confirmed case of COVID-19. The total number of confirmed cases in all of the institutional settings in total is 35, and that includes both employees and residents. There are 3 facilities that have 3 or more confirmed cases of COVID-19. Staff, residents, and family in these facilities have been notified that there is an outbreak. These facilities are Kensington Assisted Living in Redondo Beach, Belmont Village in Hollywood, and Alameda Care Center in Burbank. I want to note that there have been no deficiencies identified at these facilities, and that staff and managers are doing their very best to protect the health of their residents. It is unfortunate that this virus knows no boundaries, and it can be imported and exported wherever there are people. As of yesterday, over almost 11,000 people have been tested for COVID-19 in LA County. About 11% of them have been positive. The rate of positive cases has remained relatively steady over the past 2 weeks, either 10% or 11%. As our testing capacity is increasing, I know that there's more and more demand from the general public to get tested. We ask for your patience because there's still a very long turnaround time on getting results because there's a backlog at the labs and there still is limited capacity. So please talk to your provider and make sure that you're both symptomatic and that your provider has determined that it's clinically important for you to get tested at this point in time. And as a reminder, if you're not experiencing symptoms, it doesn't mean that you're not infected and that you can't get infected. So please stay home and only go out for essential services. And when you do go out, practice social distancing staying 6 feet apart from everyone else as much as possible. I also want to announce today that our health officer, Dr. Davis, is ordering the temporary closure of all public trails and trailheads, as well as beaches, public beach parking lots, bike paths on the beach, and beach access points through a health officer order. This order is in line with our past efforts to slow the spread of COVID-19 throughout the county. It is crucial that we limit access to non-essential places where crowds have been gathering. And the order is effective immediately and runs through April 19th, 2020. I ask that you help us by not going to our beaches and not going on our hiking trails, at least for the next few weeks, while we again try desperately to slow the spread of COVID-19. Many of our parks do remain open, so there are opportunities for people to go outside and enjoy our beautiful county, but only if we can all practice social distancing. We cannot use our public spaces, as beautiful as they are, as places where crowds will gather and people will socialize with others that aren't in their household unit. And I know how hard this is, and I know how isolated everyone feels, but we're in this together. We do it well, and we stand a chance at slowing the spread. We don't do it well, and our numbers can exponentially grow each and every day, which again, as you know already, results in more loss of life and more people with serious illness. I want to remind everyone that the tools we have to slow the spread of COVID-19 are limited, and they require all of us to be part of adhering to the guidance and the directives. The first ask we have is for you to socially distance and to stay home. Please stay home. You are safer at home, and others who are essential workers are safer if you stay home. Everyone should be staying home as much as possible and practicing social distancing when you're out to procure essential services. This always means keep your distance 6 feet apart from everyone else. The second tool is our tool to self-isolate. These are for people who have tested positive, are waiting for their test results, have had a provider tell them that they are likely to be COVID-19 positive, or people who have had mild illness. If you're in that group, you really need to self-isolate. And that means you have to stay at home and away from other people in your household for 7 days and 72 hours after your symptoms and your fever subside. No shopping, no hanging around with others in your household, and please try not to be the caregiver for either children in your household or the elderly. The third tool we have is self-quarantining, and this might be the hardest because oftentimes people have no symptoms and they feel fine, and we ask you to also stay home, stay away from other people, and to do this for 14 days. These are people who are close contacts of people who either have a confirmed case of COVID-19 or are presumed to be positive for COVID-19. This is a lot to ask, and I'm sorry to be the person that comes before you every day letting you know how important it is for you to help us. But it is really important. And it's a good idea to prepare now and plan for how you'll manage in case you need to self-isolate or self-quarantine. Be sure you have 2 weeks' supply of essential medicines at your home, and now's the time to make arrangements for how you would get the necessities of life delivered to you if you, in fact, needed to quarantine or self-isolate. Please do your part. Please try to adhere to the directives. Working together does save lives. Thank you very much, and I'll open it for questions.
And as a reminder, if you do have questions, press 1, then 0 on your touch-tone phone. You'll hear an indicator that you've been placed in queue.
Oh, before we go to questions, I'm totally sorry. I want to have Mr. Jones come up. He's the Director of Beaches and Harbor.
Good afternoon. The Department of Beaches and Harbors operates and maintains many beaches along 25 miles of the county's coastline. Last weekend, we saw thousands of people congregate on our beaches despite requests to stay safer at home. To discourage further unsafe gatherings along the coast, we removed volleyball nets and closed all beach parking lots. But given the spread of COVID-19 in this county, that is not enough. This morning, we began closing our beaches altogether and shuttering remaining beach amenities, including restrooms and the bike path. We are posting signs and taking other steps to notify beach patrons of these closures. We request that everyone abide by the health officer's order. For the health and safety of all Los Angeles residents, we cannot afford to see a repeat of last week's crowded beaches this holiday weekend. The risk of spreading COVID-19 is too great. Please stay home. Beaches and harbor staff will be monitoring the coastline and coordinating with the lifeguards and local beach cities, including Malibu and the South Bay cities, on this unprecedented closure. We will also be coordinating with the sheriff and local law enforcement agencies to ensure compliance with this order. Additionally, we are coordinating with the City of Los Angeles, the City of Santa Monica, and the state, which also operate beaches in the health officer's jurisdiction, and with the Department of Public Works, which operates the now closed bike path. I want to acknowledge Supervisors Hahn and Kuehl in their leadership in assisting with the facilitation and coordination with the beach cities in their respective districts. I want also to express my appreciation for the work done by DBH crews 365 days a year to care for our iconic beaches, which are an indelible part of the fabric of Southern California and known throughout the world. The mission of the men and women of our department is caring for our coast, and they will do so throughout this pandemic. But now is also the time for us to care for one another, to care for ourselves, and to care for our community. If we help each other now, we'll be back at the beaches soon. Thank you. And now we're ready for questions.
And as a reminder, ladies and gentlemen, if you do have a question, press 1, then 0 on your touch-tone phone. You'll hear an indicator you've been placed in queue, and you may remove yourself from the queue by repeating the 1, then 0 command. As a reminder, please pick up your handset and make sure your phone is unmuted when pressing your buttons. Our first question will come from the line of Jim Roop with Westwood One Radio Network. Go ahead.
Hi, good afternoon.
Good afternoon.
The situation that I am seeing at food preparing places, restaurants that are making food for takeout and delivery, I'm still seeing, for instance, I saw at a drive-through window an employee take money from a patron and then go put French fries in a bag and their palm touching the French fries. I'm seeing not really a whole lot of sanitizing going on. They're wiping counters with the same damn cloth, damp, I said, and they're not wearing gloves, they're not wearing masks. So what are these restaurants being told to enable them to not facilitate the spread and protect themselves? And then has there been any thought to recruiting medical students, nursing students to help take up the slack from our healthcare workers? The medical students, the student nurses could do triage or take vitals of patients, not COVID-19 patients, but other patients to kind of ease the burden there. Has there been a thought about medical students being recruited?
Yeah, thanks so much for your questions. And absolutely, medical students are being recruited for a variety of tasks, and we totally, and nursing students. And I want to, again, a big shout out to folks who are volunteering. I know we have a group that are helping us at the Public Health Department, and I know that they're helping with some of the work in the shelters as well as some of the work in the other healthcare facilities. So, yes, a great suggestion, and we appreciate all of those who have stepped up and offered their services. In terms of your first question around what are we doing to make sure that those who are working in restaurants providing us with takeout and delivery services are doing everything they can to be protected. If they're a worker, employers need to obviously make sure that all of the places adhere to all of the regulations. None of the regulations around safety at restaurants have been relaxed at all. And we have our inspectors out doing two things. One is they're out doing their inspections and making sure that restaurants are safe places and that the food that we get from those restaurants is prepared under the tightest regulations that we have. So, you know, a note to all, we're out there, our inspectors continue to do their work on inspecting all of the food facilities. The second part of that, though, is we do have a whole group of inspectors that are responding to complaints, as always. I want to note that we've always had a complaint line where folks can go online and they can go to our call center and note that they see something inappropriate at a restaurant, and that will make it possible for us to know about it and send a team out to investigate. So that service is still available, and many of you know because we've actually responded to over 3,000 calls or people coming in on our website filing complaints and asking us to follow up. A lot of those were for places that were not in compliance, but some, like you just noted, are the regular concerns we get every day about places not adhering to sort of basic infection control protocols. So I thank you for that question. We'll take the next question now.
That question will come from the line of Claudia Pisciuto with KNX Radio. Go ahead.
Barbara, I have two questions for you. We're hearing that the health department is shutting down restaurants that are trying to get through the crisis by operating as grocery stores, that they're being shut down because they don't have the proper license to operate as a grocery store. And then also, I wanted you to respond to this LA Times report that nursing homes are not taking in people who are being discharged from the hospital if they can't provide a cure test, i.e. to negative COVID-19 tests.
So in terms of the first question, you know, there are licensing requirements. Those also have not been relaxed for public health and safety reasons. We're working with everyone we can so that they can come into compliance with the requirements, but we're also very mindful that there are licensing requirements to operate a grocery store, and they're there to protect all of us. So I think, I don't know the particulars of this situation. I know we would love to have a lot of flexibility, but not at the cost of creating additional problems with exposures to other germs to people, and that there are strict requirements in place for folks to be able to operate safely a grocery store. The latter issue is complicated. At the very beginning, the Centers for Disease Control did put out guidance that asked for what you call the cure test, and it was 2 negatives, and they had to be 24 hours apart. Obviously, because there's not enough testing going around, it's been very, very hard to actually have that happen. And CDC actually modified their guidance. But I know that many nursing homes want to make sure, because they have so many vulnerable residents staying there, that there's no way that they're introducing the possibility of an infection into a facility that's for people who are medically fragile. We're trying to work with nursing homes and hospitals to figure out better solutions, because the current solution is that we have people who could be moved to what we call a step-down facility, don't need hospital care in the hospitals, taking up beds. But we'll get back to you. We're trying to work on some solutions that make it possible for us not to have people taking up hospital beds, but we do need to have safe places for them to go, and they have to be places where people can be isolated until we figure out that they're in fact COVID-19 free. And we have to get some more consensus on how that's supposed to happen when we're not able to test everyone. Next question.
We'll go next to, that'll come from the line of David Lopez with channels 2 and 9. Go ahead.
Good afternoon. Doctor, good afternoon. A couple of questions, if I may. On the people who have passed away, are all of them with pre-existing conditions, and are you keeping any record of the number of positives who have pre-existing conditions?
It's your second question is an interesting question, and the answer is no. We have some information on some of the cases. You know, we do try to interview every single case still, and we do try to get information, and we do try to tag people who may be at higher risk for more serious illness. But I don't have like the numbers to give you. We're not sort of compiling that information and putting it on our spreadsheets right now. It's really being used primarily to inform decisions around the care for particular individuals. But I can ask my team, Dave, to go back and see if you give us a few days what we can pull together from the data that we have. And your second question was, remind me?
About the fatalities, doctor. Those who have died, are all of them pre-existing conditions?
I have to get back to you. Most of them are, but I'm not being specific today because there are some deaths that we're still gathering information about whether or not there were pre-existing conditions. And, you know, I heard from one of the families that we have to be very, very careful about how we're reporting on this. So I want to be respectful now. We want to complete the medical record reviews and make sure that we're not inappropriately speaking about the conditions about particular people who have passed. So we you know, every day I try to update you. I mean, today I tried to update you on the lack of information we had from yesterday, but I did need to verify that information. Take the next question.
Thank you. And one more.
Dave, you could keep. I think you're still on, Dave. No. Next question.
We'll go next to the line of Sonia Carlamantan with the LA Times. Go ahead.
Hi, Barbara. There was a University of Washington study released this week that projected the outbreak in California peaking on April 24th. And I'm just wondering, based on when the social distancing measures went into effect, the trends we're seeing now, if there are any similar projections for when we might peak in LA County, and what, you know, taking into account that there are a lot of unknowns, what we should be telling the public about how to interpret projections like this.
Yeah, I'll try to go to the latter one because it's a little bit easier to answer. So the modeling is only as good as the data you have to enter into the sort of the model. And we're really at a disadvantage here in LA County and the rest of California because we just haven't done a lot of testing yet. As we get more and more test results back, we're able to have a better sense of, you know, sort of what we call spread. How easily is this spreading? You know, we call it an attack rate. We really need to understand that better, but we do need some more data points in order for our models to be as useful as we'd like them to be. That being said, I don't think it's unreasonable to expect that we have another couple of weeks, maybe even 3 weeks, of the numbers increasing here in LA County. I think those projections are probably on target, given what we're seeing. I mean, you could see I reported a tripling in the number of cases over the last 6 days, and I think we're going to continue to see a doubling, at least a doubling of cases every 4 to 6 days. Given what we know about spread from other places and given what our numbers are. We have lots and lots of people who are tested positive, and if you just do those numbers alone and the math on those numbers, you can see that we're likely to have a lot of people here that are going to be infected over the next 3 weeks. And that being said, the most important thing, I think, for the public on the modeling is to really understand the seriousness of what lies in front of us, which is large numbers of people can easily get infected if we're not doing everything in our power to make that a little bit harder. None of us have immunity, and that's a real disadvantage when you have a virus like COVID-19 that seems to be so easily spread when people are in close contact with each other. And the numbers can get huge, which means the implications for the healthcare system are equally dramatic. And without slowing the spread, we could easily overwhelm our system here in LA County and the entire healthcare system in California. So that's why we plead with people, really help us, do your part. We don't have the exact numbers, but whatever numbers we give you right now, the truth is we're going to continue to see a lot more cases, and the truth is it's only by each of us taking some pretty dramatic actions right now that we have any chance to slow the spread. So thanks for your question. Go on to the next question.
For our next question, we'll move to the line of Patrick Healy with KMBC. Go ahead, please.
Thank you very much. I'll have one question for Supervisor Barger, but first a couple for Dr. Ferrer. Number one, can you yet confirm the 3 institutions under investigation there have been any deaths? Question number 2, the positive test rate at only 11% seems to imply that perhaps with better focusing, we could stretch those tests and not have to test so many negative people, not squander those tests. The third question for the supervisor is, who is in charge of the emergency operations? Is it Hamai, McGowan, or Sheriff Villanueva?
So let me go to the easier question, which is, were there any deaths in those 3 nursing homes? At this point, there aren't, but there are people obviously in those nursing homes who are ill. So we'll again, be able to report on a regular basis about the outcomes. In terms of the second question, remind me, that was about the testing. Totally agree. We've been saying all along, like when you don't have enough testing, we really need to make sure that people who are symptomatic and have talked with their provider and their provider knows what their symptoms are, make a good decision about not wasting scarce resources. So we're 100% in agreement with you. And we have sent out information to all the providers, asking them to also do their part and help us make sure that we are using this very scarce resource very wisely, because it really pains us when we know there are people in the hospital who got tested today and are now going to wait 6 to 8 days to get their results because the test got sent to Quest, and there are, hundreds and hundreds of people who were tested who are in front of them but actually were asymptomatic, taking up the time of the Quest lab to process those specimens when we really need to process the specimens very quickly for the people who are in our hospitals. So we share that concern, and we ask, again, providers to help, and for all of the public, desperate to get tested, and we totally understand that. But there still is a scarcity of testing, and we need to prioritize those who are symptomatic. I'm going to now have Supervisor Barger.
So that question is easy. Under the current charter, it is, or under the current code, it is the sheriff. So that's who's in charge.
Correct, but the board is trying to change that, correct?
Well, as I've stated, in November, the board took action to align it to reflect more what's done in other counties, and that is to allow the Office of Emergency Management to be run by the individual that runs it on a day in and day out basis when they're not even in incident command. So that was decided in November and is moving forward. Was supposed to be voted on March 17th, but now, because the board meeting was canceled, is going to be on the agenda for Tuesday.
And that would be immediate if passed Tuesday?
Correct.
Thank you.
Thank you. Next question.
We'll go next to the line of Caleb Lunetto with Signal Newspaper. Go ahead.
Hi, thank you. Right now, we've been hearing about shifting numbers at the local level in terms of the backlog of tests. And I'm just kind of curious to see, and I don't know if you've answered this yet, but are there any models out there that you guys are putting out that talk about how many tests will be done on a daily basis, say, in 1 week, and then how many tests will be done in 2 weeks, and when that will be accessible down to the local level?
Dr. Ferrer will answer that, I think.
Actually, Dr. Kazan has been doing a brilliant job trying to create exactly the system you're asking for so that we can actually predict what the daily number of tests that we have capacity to do in the county will be. I know he'll be back with us early next week. He's off right now actually working with our city partners to make sure that what we do offer is a system that's fairly contiguous across the entire county and that really prioritizes access to those who need it the most while we have the scarcity, but does in fact recognize that all of us need an improvement in the number of tests that we're able to perform every day, and that we also need faster turnaround times. You're also looking at other kinds of tests that don't require as much PPE. There's swabs that people could use themselves. But I would, if you don't mind waiting a little, I know Dr. Kazan will be back with us either Monday or Tuesday, and he'll report out with way more detail on testing capacity across the county. We're going to take the next question.
And that question will come from the line of Annabelle Munoz with ABC 7. Go ahead, please.
Hi, this question is for Supervisor Barker, and the second part of it is for Dr. Ferrer. This is a follow-up on Monday's announcement that the city had secured additional testing about 20,000 tests that they were planning on finishing by the end of the month in partnership with the county, by the end of the week, rather. So if you have an update on those tests, if they were able to complete that many tests for those specific funds. And then the second question is for Dr. Ferrer. In terms of the mortality rate, you mentioned that it's higher than New York and higher than the country mortality rate. Do you consider that that is possibly because of the low testing we have?
So on the first part of the question, the kits that were purchased or committed to be purchased, the 20,000, not all those tests have been administered. Dr. Kazan will be here next week to go over what the game plan is, because we've been putting structure in place. But as he had mentioned at the time when we purchased them, that building capacity within the labs is also an important component to this. It's not just about having kits. It's about the ability to process them and also to even administer the test to those individuals that are determined eligible to be tested. So I promise you next week we will have Dr. Kazan here to go over specifically how this all is being rolled out. But I don't think the intention was ever to have all 20,000 tests done by the end of the week. And if that was the impression, I think I apologize for that. That was not the way it was envisioned. So then I'll let Dr. Ferrer answer the second part.
Yeah, it's a good question on mortality rates. So two things to note. One is we still, relatively speaking, because obviously for the families that are losing their loved ones, this makes no sense. But relative to other places, we still have a small number of deaths here in the county. And you're right, we also don't do a lot of testing. And that really would have an impact on whether or not this mortality rate actually reflects a reality. If you're only testing people who are seriously ill, you're going to have a higher mortality rate because you're not capturing any of the people who are COVID-19 positive who may have mild illness or even less severe illness. So this doesn't really mean it's the truth, but because we're all in this space right now of not having enough testing capacity, it does give you a sense of why we're worried about the danger of having rapid increases in the number of cases, because it is associated right now with a significantly higher death rate than what we usually see, for example, for influenza. We're going to take one more question.
And that question will come from the line of Chris Weber with Associated Press. Go ahead, please.
Thanks. Dr. Ferrer, apologies if you already addressed this. I missed some of it. But the day's rise in cases is significant, of course, but it's also significantly less than yesterday's increase. I wonder if you're able to account for that. Is that just back to the testing that you were talking about?
It is.
And also on the beach closures, can Mr. Jones tell us what the enforcement might look like? Will police be patrolling the beaches, those sorts of things?
Sure. I'll definitely have Mr. Jones answer the second question. So, yes, you're absolutely right. One day we'll get tons and tons of lab reports that'll come in for Quest, for example, and then the next day we might get a much smaller number. I think as the labs figure out, their own capacity, both to process the specimens and then to report in a timely way, we've got these fluctuations. You'll notice I usually try to give sort of a 2-day average, the 2-day number as well, because I think that's a little bit more accurate. And today I spoke about what it looked like for the last 6 days so people can understand in aggregate what we're looking at. But I agree with you. Some of the fluctuations that we report are really due to how tests reports come back to us.
With regards to your question on enforcement, enforcement will take the shape of many forms across the different jurisdictions that comprise the Los Angeles coastline. That will include the sheriff's office and the various PDs with the cities. The Department of Beaches and Harbors staff also has code enforcement officers who will continue to patrol along with our operating crews. And we will essentially be a public information source and goodwill ambassadors, if you like, to try and ensure that the public are abiding by this health order. The coastline is long. There are obviously lots of access points to the beaches. So we really do need people to follow this order and to realize that it is for our benefit, entire benefit. And we will continue to coordinate with each of the city jurisdictions and beach operator jurisdictions on enforcement.
Thank you very much, and we'll switch now to Spanish. I'll give it a minute, and then I'll just do a daily update in Spanish. Buenas tardes a todos. Primero quiero expresar mi gratitud a la supervisora Solís, la supervisora Barger y todas las supervisoras del Condado de Los Ángeles. Su liderazgo inteligente y compasivo es bien importante para todos nosotros y me siento muy orgulloso de ser parte del equipo del condado. Y gracias a todos ustedes que están en esta lucha con nosotros y todos los líderes por todo el condado de Los Ángeles, quienes están trabajando juntos en este momento tan complejo. Para actualizarlo sobre nuestro estado actual, estamos tristes de nuevo de reportar 5 más muertes adicionales hoy. Esto eleva el número total de muertos a 26 en el condado de Los Ángeles. Estos números que debemos informar cada día representan la vida de personas reales. Hoy sus familiares y sus amigos lloran por estas personas. Para aquellos que están experimentando esta terrible pérdida, estamos con ustedes. Lamentamos mucho a su pérdida. Hoy también estamos reportando 257 casos nuevos. Este aumento se debe en parte por los aumentos de las pruebas. Hay más pruebas y nos estamos poniendo al día con los retrasos en los resultados de las pruebas. Pero también debemos suponer que hay una propagación de COVID-19 ampliamente en todo el condado de Los Ángeles. Hoy también quiero anunciar que el oficial de salud del condado de Los Ángeles, el doctor Davis, está ordenando el cierre temporal de todos los senderos, así como todas las playas, estacionamientos públicos del playa, senderos para bicicletas en la playa, muelles y puntos de acceso a la playa. Esta orden está en línea con nuestros esfuerzos para frenar la propagación de COVID-19 en el condado de Los Ángeles. Es crucial que limitemos el acceso a lugares no esenciales donde se han reunido mucha gente. La orden está efectiva inmediatamente hasta el 19 de abril del 2020. Muchos parques permanecen abiertos y por favor pedimos que no van con mucha gente a estos parques para que no lo tenemos que cerrar. Todavía hay oportunidades para salir y a disfrutar de nuestro hermoso condado, pero lo tenemos que hacer practicando el distanciamiento social. Les pedimos que cuando están afuera siempre se quedan 6 pies de la otra gente. Esto es significativo para que nosotros podamos bajar los números de los nuevos casos del COVID-19. Muchas gracias. Y cogemos unas preguntas ahora. We'll take a couple of questions now.
We have a question from the line of Hugo Guzman.
Hi, this
Hobby Alley.
question is for Supervisor Barger. Is the Rose Bowl really safe? I've been seeing an extreme number of people walking around there. They're not maintaining social distance. What kind of steps is the county taking to make sure the Rose Bowl stays safe?
Well, I know I said this during the remarks as it relates to the fact that we're keeping the Arboretum and some of the parks open. Common sense says 6 feet social distancing, and I know that Mayor Tornick has encouraged the residents of Pasadena who are using the Rose Bowl to walk in the morning to incorporate that into their daily routine, and it's going to be up to the city of Pasadena as to whether they don't see people complying. But the goal here is to keep as many of these recreational areas open because we're encouraging people to get out. I mean, our director of mental health has said that it's important for people to get some exercise incorporated into their daily routine. And I, again, will plead with people. We're closing the beaches because of the fact that when the weather was nice, people were congregating on the beach in small groups, but very close together. So to your point, I know that Mayor Tornick did address that in a release that he had, I think, yesterday. So we'll leave that up to the city of Pasadena. But again, please practice social distancing. Next question.
Our next question will come from the line of Rob Hayes with ABC 7 Los Angeles. Go ahead.
Good afternoon, Dr. Ferrer. Quick question. Yesterday you said the county dropped the case of the 17-year-old boy who passed away. What exactly does that mean?
Well, we dropped the case because we are waiting for CDC to complete an investigation to verify the cause of death. So as soon as we get that information, we'll either notify you that the case is it's been negative for COVID-19 as the cause of death, or we'll unfortunately, we'll add that back to our tally.
I see. And real quick, when it comes to beach violators, maybe this was mentioned, I didn't hear it. Will there be fines issued, tickets issued? And if so, what would the fine be?
Unfortunately, Mr. Jones stepped out, and I would ask him to help with answering that. But I do want to let people know, we just desperately need people to comply. The enforcement side of it always comes up, but my experience has been if people have good information, they're going to make good decisions, and we're counting on everyone to make good decisions. I know Mr. Jones has a plan, and I know for the next few days we'll have a lot of people out there making sure that the general public understands what we mean by closing the beaches and what activities are not permitted. And I'm counting on all of you to do what's best. This is not being done, in any way to try to punish people or cause a lot of anxiety or anguish or really restrict everyone's movements. This is being done because this is the only way that we have to save people's lives.
Thank you.
And we have time for one more question.
And that will come from the line of Claudia Pisciuto with KNX Radio. Go ahead, please.
Hi, Barbara. Just letting you know, I think when you went back to Dave Lopez, you couldn't hear him because we're sometimes getting cut off when we're trying to ask follow-up questions. But I just wanted to check if there have been any positive cases among the homeless or inmate population.
Sure. No positive cases to date amongst people experiencing homelessness. No positive cases for inmates in the jail. One positive case in the prison that's run by the state.
Okay. All right. Thank you.
Thank you. Okay. Thank you so much. This concludes our press briefing.
Thank you. Thank you.
Thank you.
Thank you, Doctor. Thank you.
Okay.
All right.
Ladies and gentlemen, that does conclude your conference call for today. Thank you for your participation and for using